healthcare professionals, local, just maybe a couple of local politicians, but in your professional capacity as firemen and women, police. We have our friends from FAU who are also going through similar conversations. So we hope to share there. I will turn it over to Glenda, but I just want to say thank you so much. Our goal and purpose over the next 4 meetings is to solicit your best thinking as it relates to your understanding of the COVID-19 pandemic, especially from your perspective. And we will use that information to tailor our approach. As you know, the CDC has some very strict guidelines as it relates to what's entering schools. I will preface this conversation by saying simply this. The CDC guidelines as they currently exist will be very challenging for us to bring back, say, 3,500 kids to a high school. And so we have a lot to work through, and that's why this meeting is so important to me at this time. Before we turn it back over to Glenda, I'll have Mr. Boggess and Dr. Smith say a few words, and then Glenda will be ready to begin.
Sure thing. Dr. Sheffield, is this the point in time that we wanted to have introductions? I can certainly start and say, my name is Jay Boggess. I'm an assistant superintendent here for the school district over choice and innovation, which encompasses everything from our incredible 320 plus choice programs to adult education, home education, virtual school, charter schools, and our healthcare nurses. So wanted to say hello, greetings, and thank you for being on the call.
Dr. Smith.
Good evening. My name is Dr. Smith. I'm the health service specialist for the school district. Again, just wanting to echo Mr. Boggess's thank you to each of you for agreeing to be a part of this task survey as we undergo a great task of reopening our schools. Thank you again.
Thank you, Dr. Smith. And then I know that our time, we're very limited. We do have just an hour and we want to respect everyone's time. But it's also important that we know exactly, the faces in regards to who is so dedicated to this work and will be a part of this awesome team. So I'm just going to ask that you just identify yourself. I'll call you out just to help expedite. And I think that we will just go ahead and finish up with our district team. And LaCava, is LaCava on? I think he was here earlier.
Yes, ma'am. Good afternoon. This is Gonzalo LaCava. I'm the Chief of Human Resources for the school district. Nice to be on the call.
Thank you, LaCava. And I think we also have Keith. I saw Keith earlier. Is Keith still on?
Yes. Good afternoon, everyone. Thanks for participating. Keith Oswald, Deputy Superintendent.
And then Ed Turney. Is Ed here?
Good evening, ladies and gentlemen. Ed Tierney, Chief of Staff. Nice to see you.
And Michelle, were you able to get back on?
Yes, ma'am. I am here. Thank you so much for inviting me. I am Michelle Fleming, new Director of Administration and Compliance, and I am also on the reopening task force. So I'm very excited to take this work back to the team and kind of synthesize it all. So thank you for having me.
Thanks, Michelle. And Kathy. Maybe Kathy wasn't able to join us.
I'm here. Thank you. Thank you, Dr. Sheffield. Just taking notes. Thank you all.
Awesome. Thanks, Kathy. And Wanda, Chief Operating Officer, is playing a very integral part in this, of course, talking about the reopening and getting our buildings ready. Wanda, were you able to join us? Okay.
Yes, I'm on, Glenda. I'm here. Thank you.
All right. Just wanted the team to be able to put a face with the name as we talk about, of course, this awesome work. Are there any other district staff on that I was not able to just call you directly? And I don't think Mike is on. Is Mike? Okay. If there is no other district staff on, I'm just going to ask our committed business and community leaders, if they would just do a very quick hello so that we could just put face with the name, and again, how much we appreciate you. Caden Leggett, I'm going to start with Caden. And again, I do apologize for the enunciation.
Please forgive me. It's actually Thamarva Mitchell. I am the program director for All Metro Healthcare.
Okay. Thank you for joining us.
No problem. Thanks for having me.
Anthony Barber. Anthony, if you're speaking, we can't hear you. Okay, we'll come back. Anthony? Okay, we'll come back. I think he's having some difficulties there. Okay, Ophelia?
Yes.
Okay.
Hello, everybody. Yes, I'm Ophelia Barlera Chacon. I am a physician with a PhD in microbiology, and I retired, and I am actually now an instructor with the medical sciences program at the district.
Okay.
Very glad to be here with all of you.
Thank you. And Cleo Ortiz?
Hi, can you hear me?
Yes, we can.
Yes, I am Cleopatra Ortiz, MD. I am a physician and a child and adolescent and adult psychiatrist. I've been working as a consultant for the school district most of the time working at Indian Ridge School, but I do get referral from the 174, whatever number of schools for potential referral of students that might have a mental illness. So what I do is psychiatric evaluations and medication management. And I'm happy to be here today.
Thank you. Thank you. And Representative Wilhite, it is so awesome to have you being able to log in. I know you were having some problems logging in. So Representative Wilhite, you want to introduce yourself?
Well, thank you. I actually used my phone. I got in, so hopefully this works good. As you said, I'm a state representative, but I'm also a fireman, as Dr. Fenoy mentioned them. But more importantly, I think I'm a father of 2 kids who go to public school here in Palm Beach County. So I think I fill a little gamut of different aspects of this, and I appreciate the ability to serve on this, and I look forward to all the good work that'll come out of this. Thank you.
Thank you. Thank you. And I do apologize again for for the issues you were having getting on. And Stacy Volnett?
Hi, good afternoon. I'm Stacy Volnick. I'm the Vice President for Administrative Affairs at Florida Atlantic University. A couple of the relevant areas that I oversee are emergency management, environmental health and safety, and human resources. So intimately engaged in a return to campus in the fall. And we also have, as many of you know, a K through 12 system on our campus. So dealing with that as well. Thank you.
Okay. Well, thank you. And if I left anyone out, by all means, please introduce yourself. But I think I have everyone. So hopefully I did not miss anyone.
This is Tommy Scheckman. Can you hear me?
Okay, Dr. Scheckman, yes.
Yes, I think you left. Okay, so I'm having trouble logging in on Google Meet, so I'm called in. I'm not sure what the issue there is, but I am a pediatrician with multiple offices throughout Palm Beach County. I'm a medical consultant for Palm Beach County School District ESD program, and I'm also a former president and on the board of the Florida chapter of the AAP, and part of our involvement at the state level with reopening of schools throughout the state.
Thank you, Dr. Scheckman. We just let you win the Google Meet. I was able to fix it for you.
Oh, okay. Oh, join now. Okay. All right.
I'm Dr. Marcia Rodriguez. Can you hear me?
Yes.
Yeah, I'm Dr. Marcia Rodriguez. I'm an internist serving a large part of the community in Boynton Beach. I'm the treasurer of the Palm Beach Medical Society and on the board of the society and the executive committee. I'm also very involved with the medical academy for the Palm Beach district. The students go through my office a lot.
Okay, thank you. Thank you.
Hi, I'm Dr. Miriam. I'm Dr. Gilmore. I am the director of behavioral health at Fund Care. And also, as you know, Fund Care has been very one of the leading agency in testing for COVID-19. So I'm glad to be here.
Okay, thank you for joining us.
Hello, I'm Joelle Cody, one of the contract nursing supervisors with All Metro. Thank you for inviting me.
Thank you. Thank you. Is there anyone else? Okay. Well, thanks again, everyone, for partaking and being a part of this outstanding group of leaders. And what I'm going to do now is to shift us directly into our conversation. So I'm going to be sharing my screen. So if you would just bear with me as I pull up and begin sharing my screen. And as I share my screens, Mr. Bacchus is going to go ahead and lead us into our conversation here.
Certainly so. Good afternoon, Team Palm Beach. Glad to be a part. And as we stated in introductions, we have assembled what we're considering the best and brightest in this area of expertise to help the school district of Palm Beach County and Dr. Fenoy help take progressive and leadership approach to reopening our schools for the SY21 school year. As we've heard throughout COVID-19, there's been a mantra or tag from social media to news that we are in this together. And I can tell you from a school district perspective, we're focused on three key priorities. That's health, safety, and learning. As we look to reopen nearly 187 plus schools and nearly returning 190,000 plus students, public school students to Palm Beach County, that's an incredible lift that we've done every year, but we've never done it like this. And so the charge that Dr. Fenoy has had to us as staff was really, division, can you put together the best and brightest that Palm Beach County has to offer in areas of expertise of medicine, CDC guidelines, infectious disease? Because the truth of this is that we're professional educators. Our role and responsibility is to help inspire and empower a new generation of young people to do amazing things. What we are not are, as the list went on, infectious disease specialists, pediatricians, captains of firefighting, epidemiologists, chief medical officers. So that's really the point and purpose of this collective. And what you have in front of you is really a breakdown and framing of what this group and this task force is going to be accomplishing. And we broke it down into, as we do in everything with the school district, student-centric. If you see right there in the middle, it's students first. Healthy, safe, and ready to learn. We've categorized individuals and their leadership roles into 4 non-hierarchical principles. The first being care coordination. And I'll take a moment just to identify a handful. That's everything from that pediatrician, Dr. Scheckman, to our infectious disease doctors. Anyone that really plays a vital role around care coordination and what that looks like. That's one area of key principle that this task force, this committee is going to be a part of. When we look at leadership, this is, as you heard from a district perspective, you've got the chief operating officer, Wanda Paul. You've got other aspects around chief finance and chief of HR, but that's internal. We need external providing great conversation to what this looks like as we return. And that's going to be everyone from Representative Wilhite, other community leaders that we have. Leadership extends across all of these, but that was the category title that we've placed for that principle. The third is quality improvement. A lot of these aspects are internal, but again, some external aspects of how we lay out best practices, that we're using data points in order to, over the next 30, 60, and 90 days, really laying out what that reentry plan is going to have and what it's going to look like. And the last key principle that we have in place is community and public health. These are the folks from our Department of Health. These are our partners at Quantum Foundation. These are our partners at Florida Atlantic University, at Palm Beach State College. These are the folks that are walking the same tough, difficult conversation about what it looks like to social distance with multiple students and class sizes and all those other aspects. So we're really leaning on these 4 key principles to help drive conversation and really to help align what student-centric return is going to look like. As we transition to the next slide, Dr. Fenoy hit on the point and purpose of what this is going to be creating. And there's not a lot of definitives in our world today, but there is one definitive from a school district of Palm Beach County perspective. And that is the assurance that on August 10th of 2020, we will have our first day of school. And in doing so, this advisory committee is part of that. In fact, it's an integral part of that. And as we talk about we are in this together, your expertise, your knowledge, your years of sacrifice and service are being brought to the table and helping our superintendent and that cabinet level to really make the best decisions for that 190,000 students, and really focused on what it's going to look like for our families, for all of our stakeholders. Because whether you have a son or daughter within the school district, like Representative Wellhite has, or I do, or Dr. Fenoy has, we all have cousins, brothers. We've all got church members and families and friends all coming to a public school here in Palm Beach County. So as a collective, we're helping to make decisions that are in the best interest of our kids and ultimately our community fabric as a whole. So I think between those two slides, we've set purpose. And at this time, I'll turn it over to Dr. Smith to kind of start to detail out some of the perspectives that we've heard back from you when it comes to that 3-question survey. And again, thank you for your time and giving extensive feedback. And we've tried our best to capture and frame and package that so that we can talk about some of those points today. At this point, I'll introduce Dr. Smith to help us walk through some of the survey results.
Thank you again to everyone who completed the survey. As you noted, we sent 3 questions to our participants, and we had 9 participants out of our 12, which were great. And we wanted to basically get a feel of where everyone was from a personal perspective as well as a professional perspective. And when we look at our first question, we wanted to, basically ascertain how you felt regarding our schools reopening. Was this something you were very concerned about? Was this something you were somewhat concerned about? And if you look at the results, basically 7 of the 9 participants were very concerned about the reopening of the schools. We did have 2 persons that were somewhat concerned, but the majority was very concerned. And so then when we looked at the reasoning for your concern, and I won't go through all of these, but some of the major issues or major concerns were surrounding our purpose here. How would we as a district go about creating protocols and plans that could actually provide safety for our students and prevent, our students from being more at risk? A number of you were very concerned about the uncertainties and the unknowns regarding the virus. As we pay attention to the media every day, there's changes. I used to say every day, and now I say there's changes every minute. If you're watching the news, every minute you get something new regarding this virus. So that was a concern for some of you as well, as far as also our numbers in Palm Beach County. Although our numbers are not increasing as much as they initially started, they're not totally decreasing. We're still seeing numbers each and every day. So that too was a concern for some of you in relation to us reopening the schools. We also looked at getting your input on how we as a district could effectively and safely implement some of the things that the CDC are saying is necessary. For example, our social distancing, the wearing of personal protective equipment, or any other measures or areas or preventative things that we could do to actually, again, get our kids back and get them back safely. Some of you were very concerned, and some of you thought about increasing our cleaning, our cleaning and our disinfecting protocols. You wanted that to be increased. A number of you thought about delayed start to school. Some of you talked about, utilizing, again, PPE, which is our mask, which are, gloves, conducting daily temperatures of our students. So there was a number of thought processes going, but for the most part, all of you were in the same, or should I say your responses were very similar to each other. Our third question looked at what can we do specifically toward increasing our cleaning and our disinfecting protocols, again, to ensure safety. Again, looking at our buses, looking at our cafeterias, looking at our classrooms, all of these areas where our students frequent. And again, some of you felt like increasing the cleaning, hiring janitorial staff, and increase in staff, cleaning high traffic areas every hour, every 2 hours. But again, everyone, all of the participants had the same or similar thought processes in regards to that question. So there's no misunderstanding that this is very concerning to each of you as it is to me. It is very concerning that we put a protocol or protocols and a plan in place to increase the safety of our students, and that we do have some form of social distancing, PPE, and that we do increase our cleaning efforts, because these are some of the things that are going to help us in minimizing the spread of this virus. So again, I do thank you for your time. I thank you for your responses. And I'm just glad to know everyone's mindset is in the same place.
Okay. Thank you, Jay and Dr. Smith, for taking us through, our purpose and our why, and most importantly, the needs of our current state. And at this time, I'm going to allow Dr. Fenoy to weigh in, as we have shared with him in regards to, the results of the survey. And now that you've had an opportunity to see in regards to some of the overarching concerns, Dr. Fenoy will, begin to lead us through some of discussions, and authentic and courageous discussions, because your discussion here this afternoon is definitely going to help our, reopening task force, that team, to navigate through many of the unknown and things in terms of what needs to be considered, to, of course, talking about the safety and well-being, not just of our students, but the adult learners as well. So Dr. Fenoy.
Yeah, so I want to say one quick thing, and then I want to turn it over to all of our committee members to begin the discussion. So just to give you some contextual pieces, Palm Beach County Schools has over 30 million square foot of air-conditioned space. We have over 179, let's just say 200 total buildings, schools and ancillary buildings that encompass both students and adults. We have roughly, just to say, 1,000 buses on the road at any given time. And so I think I just want to put that out there contextually when we start talking about the things that we need to purchase. So we just purchased 1 million masks. We just made a decision a couple of weeks ago to buy 1 million masks. So we don't yet know, and we think that's enough masks to cover all of our staff. We crunched the numbers, providing masks or some sort of face covering for every student in the district every day is just a number that is just astronomical, considering 200,000 kids every day. And so that's kind of how I want to open discussions, to help you understand just how big we are. We have close to 23,000 employees as well. We have a very significant portion of our employment staff, and Dr. LaCava can quote me, but I think in average, we're over 1,500 employees that are over the age of 65 or 65 and older. So that's something else contextually I want you to understand. Yeah, so I think that, and then I think the other challenge is obviously, especially those who are paying attention to the economic piece, we're getting a lot of pressure, even for the summer, to open camps, because people must go back to work. And we fully understand and appreciate that as well. So I don't think I made our job any easier, but for my friends at FAU who are also similarly going through this, to all of our medical professionals, we really need to hear what you have to say about this. And I think, and as well as someone like other medical professionals or other public servants who are also seeing this firsthand as they go out and look at different buildings. Because I think really at the end of the day, we have to come up with something that's reasonable. I think we have parents on all sides of this. Just to let you know contextually, we get emails from parents that say, if you do any of that CDC stuff, my kids aren't coming back to school. Then we have other parents that are like, if we can't guarantee there's a vaccine, they're not coming back to school. And some people tell us, I'm dropping them off on August 10th, whether you're there or not. So that's kind of the context of where we're at. So at this time, I would open up the floor for the final 30 minutes, just to hear from all of our different friends who are on this call. And I expect the team to start taking notes as it relates to the things that you're hearing. Then just to follow up, our next meeting, which will be in a couple of weeks, we will give you progress of some of the decisions that we made based on your feedback. And then we'll probably have another round of surveys just as we kind of get tighter and tighter towards our deadline of making a hard call about getting back to school. So at this turn, I turn it over to anyone who's willing to start the conversation around the things that you're concerned about and things that we should be considering as it relates to getting back to school. Thank you.
Well, this is Stacy from FAU. I don't mind starting. I think that when we are presenting our plan to our Board of Trustees on Friday, and then to our Board of Governors at the end of this month. And I think as it relates to the survey results, really, when we looked at it, it was about a public awareness campaign to really promote a culture of safety as it speaks, as you spoke to, social distancing as well as face coverings as being really that being the initiatives that would mitigate the spread of the virus, at least in terms of what we're hearing and what we're hearing also from the Florida Surgeon General. We also focused on the cleaning and disinfection plan, and I can relate. You know, we have 150 miles of coast, over 200 buildings, and a significant amount of square footage as well. And we really realized that we needed to redeploy the workforce out of those areas that are not high traffic, high touch, and focus on the areas of significant traffic, and really needed to make this a all in it together campaign in terms of faculty and students and I realize we're dealing with adult learners, but as they walk into a classroom, take a wipe and wipe down their specific workspace, knowing that it's not feasible to send in a crew after every course, at least at the college level, to disinfect a class in between each class. We would have to have hundreds of people to do that. So the disinfection and cleaning plan is really paramount as it relates to food service, as it relates to the libraries, high traffic areas, our buses. Face coverings will be required in our classrooms. They will be required on our school bus shuttles. They will be required in any high traffic areas and even traversing the campuses. So that's a requirement. And the other was a real strong virus testing program, but really a contact tracking program. So in terms of what our focus is and our plan, really those are the big pieces. The public awareness campaign around the new norms, the disinfecting and cleaning plan, as well as our contact tracking plan. Obviously, with that comes compliance and enforcement for all of our student conduct folks and our HR folks. You know, what do you do when a student or employee does not follow the guidelines that we've put forth? So that's really critical piece of what we're doing. And also, obviously, working with the community. I mean, we've reached out to many other organizations that we work with regularly too, where our students intern to hopefully carry that culture of safety to those places that our students also work and spend time. So those are some of the focuses. Obviously in the classrooms, it's difficult, but social distancing, hybrid models, a lot to think of in terms of keeping the classroom safe and traffic flows within those classrooms. So just a little bit of what we're doing, and I can certainly share greater details of our plan.
So this is Tommy Scheckman. Now that I'm Google Meet, can you all hear me okay? Yep. So I think that I'd like to take us in a little bit different direction, maybe more of a medical direction, perhaps, and a healthcare direction. I think I'm going to try to be as brief as I can, but there are many areas that I think we need to address. First, even before we start, we need to have a campaign to make sure that children are adequately immunized. You probably have read many statements coming out of national AAP as well as Florida AAP. Immunization rates have dropped precipitously during the last 4 months. So I think that's something we're actively trying to campaign, but I think it's very important before we have a measles outbreak or another preventable outbreak. Two, I think, and again, it's early, but I think we need to encourage if it was me, I would say every staff member has to receive the flu vaccine, just like we do in our offices. It should be mandated, as far as I'm concerned, for all staff. And I think that we need to really encourage it for children. As an aside, it won't happen here in Florida, but we're trying in other states to mandate flu vaccine for school entry. Again, the confusion we're going to see this fall, and I'm a very optimistic person, but what I'm seeing in Florida, what I'm seeing in Arizona right now is not a good bearing for what's going to happen in the fall, and the confusion, and on top of that, the overlaying flu. So I think we need to be aware of that. My biggest issue that I think we need to look at is what are we going to do with sick children when they come to school? And that may be with fever, without fever. What's our policy? Do we have testing? Do we have contact tracing? Are we going to shut down a classroom? Are we shutting down a school when X number of kids have COVID or have flu? Okay. I think I haven't heard any of that really mentioned. I think I put that on my survey. I think that we need to start understanding how we're going to respond. I think the public health concern of that is tremendous. So I think that's something we need to look at. We need to, look at the transition back to school, both from a social and mental health perspective. A lot of our students, I'm seeing it amongst my patients and elsewhere. This is going to, like Dr. Fenoy said, there are different, everybody's a little bit different. Do they want to be in school, not in school? The anxiety levels, I think we need to be very cognizant of the sort of re-entry from a social mental perspective. Then I think we also need to not forget that we need to address children with special needs. This is children with special needs that may be in the developmental realm, the mental health realm, but also physical. And I think that I'm not sure who is looking at that, as far as kids with tracheostomies or other kids who are immunocompromised. What is our policy? What is the school? How we're going to address that? Hospital homebound. I can tell you that one of the things that we have seen over the last 3 months is that children with special needs have really, really suffered from the standpoint of remote learning. We all understand this was done quickly and there were very little options, but I think it's something we need to address and how we're going to provide those services. So that's just sort of some quick thoughts on what I think we need to be approaching and what we need to try to be prepared for. I think that the key here is to prepare. What bothers me overall is that we have, not just, not talking about school, but state, national, very few people are really trying to prepare for the fall. And I think that's what we need to be able to do.
Thank you so much, Dr. Schechtman. Just to recap on Ms. Volnick and Dr. Schechtman, some key takeaways thus far that I think we as staff have down, and some potential talking points around are changing personal habits, as Dr. or Ms. Volnick talked about, high traffic, high touch areas, disinfection, and then transitioning to Dr. Schechtman, really around the response once they're on our campuses. What's the action plan? We're looking at adequate immunization, flu vaccine, aspects around what do we do with that sick child that shows up at XYZ elementary, middle, or high? What is the action plan around it? So given those two, and thank you both for your input, given some of the medical perspective and then also from an organizational perspective, what are some other key aspects that Dr. Fenoy led out with that question that we can dive into today? Rep. Wilhite.
Thank you. And obviously, a few of those questions and comments from the previous two speakers were things that I haven't even thought of. Some great questions there. From the state aspect, the state is vastly different from the Panhandle down to Palm Beach County. And Dade, Broward, and Palm Beach have been separated from a lot of the other counties because of our population. And so that, in turn, has put us behind in a lot of aspects of reopening and doing different things to begin with, let alone schools. We still have increasing numbers in the state. We still have increasing numbers in the county. We're still having ongoing testing. The testing has increased, but that the turnaround testing has decreased, thank goodness. But things that concern me that that we've started to open things up. We still don't know what the long-term effects are. And not to mention some things happening nationally, let alone our state, with large crowds gathering. We don't know how much the community spread could be from that. And so we could still see big numbers of this happening or coming back to us by the time we even think about summer break, or even starting school again. So a lot of those things concern me. I think when I think of an aspect as a father, would be not eating in the cafeteria and limiting it into your classrooms to try and isolate groups of people and not so much cross contamination, things like that. Or, do we have enough bus drivers to accommodate less kids on a bus? Because right now I know that our buses are full. And so would we even have enough staff from that? One of the most interesting questions that was asked on another survey Dr. Fenoy sent out the other day was about year-round school. I'll tell you that I've had lots of discussions about that at state level. I actually asked former Governor Jeb Bush in a comment question meeting about that. And, it's been talked about. Other states have done it. Other countries are doing it. I've always looked at a model of places like China and Finland and others that have year-round schooling and comparing our school statistics and learning grades to other countries instead of other states. And that's an option, because if we have to limit the number of people on our campus or in our buses or in our cafeterias, we probably just don't have enough year-round time to do it, or school time to do it. That year-round may be something that's needed. So, I think we're always going to need more testing. I think some of those great questions that were asked about what happens if there is someone that tests positive, how do we isolate that? Because then, I can tell you from the fire department, when someone tests positive, we take like multiple people out of work until the results come back. Well, we couldn't do that with a whole classroom, because then their grades would fall behind, or their learning levels would fall behind. So how do we answer those questions? So I think this meeting, this dialogue, getting a lot of input from the vast number of people that are on this and diversity, I think is great to get a lot of these. So I'll do whatever I can. I'll get you whatever data I can from the state level. I know you have direct connections with the Board of Education or the Secretary of Education, but I can assist in anything you need, and I'll be able to do any of that you need. So I appreciate the opportunity to do this. One question I would, if you could answer back, because it has been talked about so many times, is the age of our students don't seem to transmit as well. But Dr. Fenoy mentioned the number of school board employees over 65. I think it's a great question, because so many people have said we're not worried about the transmission in kids, but I've always said that our cafeteria workers and our principals and all those other teachers that are over 65 could be that spread, let alone, parents and kids have elders living in their homes that they bring it home to them. So I think those are things that we really have to think about when we say about the community spread and how this could happen. But then thinking another thing from my aspect is we use our schools as voting precincts. Do we want to open our schools up to voting precincts, which I completely support? We need to continue voting. It's our right that we should take advantage of. But, do we bring all kinds of people from the outside public into our schools a couple of times during the school year to potentially contaminate the school? So I asked a lot of questions in my survey, and I think everyone else did, and I think it's great, and I appreciate the input and the opportunity.
Thanks, Representative Wilhite. I have a question for the group that's really bothering us. So we just purchased about, let's just say, 2,000 thermometers. We honestly don't know. We've heard mixed things about thermometer checking. And it's just a question that I have for this group. And for me, it's more of a practical issue. So if I'm at Boca Raton High School with 3,500 kids, like physically, how would we even check their temperatures to get on campus in a reasonable amount of time? School will be over. But then we can back up a little bit. For those children that ride buses, do you check it at the bus stop or do you check it at the school? And so I need to hear from you guys about the whole temperature taking thing, especially with the handhelds. We don't have the money right now to do the thing in the camera in the sky thing. We don't. But I just want to hear all of your perspective on this.
So let me see if I can help address that. Number one, the camera ones or the laser ones are not very accurate to begin with. Two, when it comes to children, 100.4 temp, in adults that can be considered fever, but for children, it's very much at the low end. But here's the deal. I think, we have to have questions, and, do we want to ask, do you have fever, and ask more from a history standpoint? We don't take temps coming into our office. I can tell you that the esteemed Mayo Clinic, most hospitals, we're taking temps before guests and employees come into their hospitals, but many hospitals have found out they haven't really picked up anything that they wouldn't have picked up anyway. Mayo Clinic at all three of its hospitals and all its clinics are not taking temps. So there's a lot of controversy, and I agree with you. I don't know how you're going to be able, if it's really going to be a screening tool that's going to be very useful. I think there needs to be better collaboration with the community, with pediatricians, contact, having some, ability to be able to self-report, trying to encourage parents and students to stay home if they're sick. But, if you take it at 7 o'clock in the morning when temps are typically a little bit lower, what does it mean if the child doesn't have fever at 12 noon? So I'm not seeing a lot of real value. Again, I'm more concerned about what are we going to do when the child is sick, whether they're at home or in the classroom, and how we're going to contact trace and what we're going to do about closures. So I think those are bigger issues that we need to be prepared for.
Hi, this is Dr. Martha Rodriguez. Thank you for having me. I have a couple of points. I too don't agree with taking temperatures. People easily, if a parent has to work and needs to drop the kid in school, can give them Tylenol before they get to school, and the temperature is going to be normal. And that's something that is reality. People have done it all the time before getting on airplanes. So I believe that temperatures are useless. But I have a question about the summer. We have the gift of 60 to 90 days to practice what we're going to do. Is there any thoughts about smaller camps where we can try different approaches and see how they work before we expand them to bigger facilities? That's my first thought. And then my second thought is, has anybody approached the private sector, the Apples, the Amazons, the Microsofts of the world, to see what they can contribute to the school district? Those are my two thoughts.
So we are opening up summer camps. We made a decision about a week ago. We presented to the board last week. We're starting with our first 13, and then we're also considering opening up church leases as a way to kind of test protocol, see what happens. And then maybe in July, we would open up our schools to maybe special ed summer programming. But we're being very cautious around that. So we want to test it, to be honest, with people that aren't our students first, and just kind of see what happens. And then kind of learn from that experience. So yes, ma'am, we are doing that.
Do we have anyone else want to engage on the thermometers and Dr. Fenoy's ask around what that looks like within our school system?
I'd just like to ask a question. I did hear Dr. Fenoy say that, you all have purchased masks and some thermometers. But quick question, where was the data behind the amount of items that you purchased? Did you all say, okay, let's base this on the first couple of schools for a summer? Or where did you guys derive from that amount of?
Yeah, so our decision at the time was actually more of an economical decision. So we knew we needed to buy something. So we just basically used our best judgment, with the understanding at that time that we ordered that people all over the country were ordering in large numbers. So we just started stacking our warehouse with as much as we could. But we have yet to, it was no real science. We just figured we'd just do 1 million masks to start so that we could have them in the warehouse and get in front ahead of everyone else who was ordering across the world. That's all it was.
Okay.
Okay, so, hi. Okay, so what I have been doing during this time, actually, because I have both the experience as a physician, as a microbiologist, and now also as a medical sciences teacher. So during all this time, I have been looking actually at the real situation at the schools, plus I have been looking at the developments of COVID-19, both in research as well as how other countries have been doing when addressing the situation of schools. And obviously, I agree with Dr. Shesman that, the taking of temperatures sometimes can be a little bit tricky. And I never had thought also about the situation of actually parents giving medication to the kids in order to get them to school. However, in many other countries, like in China, in Taiwan, they have as a standard procedure to take the temperature, not only for the kids getting into the school and the staff, but also in some other areas like getting people into the malls when they reopen the businesses, taking the temperatures. So my take in that is that many people are doing that, perhaps trying to get the higher end, like, the kids and the staff members who are going to show up with high temperatures, which will be some of the ones that we probably will be able to get to detect with that procedure. There are other things, however, that I believe are very, very serious to consider in the schools. And now I am actually also helping a committee at the University of Nebraska, because I used to work there. And the medical center of the University of Nebraska has been addressing actually very specific cases of COVID-19. And I'm working now helping the School of Biomedical Sciences. Now they are developing actually their procedures and their operating procedures on how to get staff and graduate students back into the school. But some of the things could be applied to our schools. For example, I believe some things that are very easy to start addressing are, for example, the one-way circulation, how people are going to circulate in the schools, the use of the bathrooms. That's something that actually I detected, I identified as a key issue with my own students here. When we were having the virtual school, my medical sciences students, one of the homeworks that I gave them is, we were addressing infection control, and I asked them to figure out areas inside of the schools that would be really difficult to address. And one of the things that came with my students was, for example, the use of the bathrooms, because they say sometimes they can be very, many, actually several students trying to get into the bathroom. So how are we going to address that? And my idea is, for example, to have somebody verifying that we are going to have only one kid getting into the bathroom, or two kids at the same time, and be sure that they sanitize their hands when they come out from the bathrooms. The same thing, sanitation of hands getting into back into the classrooms, or when they are going to the cafeteria, for example, we could implement, if they are going to go to the cafeteria, perhaps have them one with some divisions, because I have seen that. I did that in China, they did that in Taiwan. Yes.
Yes, ma'am. Dr. Shercone, that awesome. We greatly appreciate that. I'm as moderator or part moderator, I'm looking at the 5:55 mark here, and I want to make sure that I get an opportunity to recap here for us, and make sure that Dr. Fenoy and Dr. Sheffield have time for closing remarks. Going back from Ms. Volnick to Dr. Shetman to Representative Wilhite, we've talked around how Palm Beach County is so unique in this. It's not like Alachua County or Glades County. It's very distinctly unique in South Florida. We've talked everything from annual year-round school to concepts around mass gatherings and cross-contamination, as you just brought up, Dr. Chacon, around bathrooms or cafeterias, and really looking at this, really response to what it looks like if a student shows up. Do they have the fever? We've heard mixed data points thus far. So I want to make sure that I've captured as much as possible in this, and I know we've got other staff doing the same. But at this point, at 5:55, I'll turn it to you, Dr. Sheffield, for next steps and how we're going to close out this meeting.
Thank you, Jay, for moderating this for me, for us. And of course, before we talk about the next steps, I just wanted to see, again, is there anyone else that wanted to share out? Because of course, we would love to hear from everyone, but we also want to make certain that we respect your time, because we want to make certain that as we talk about our next meeting, that we have you back. And what we're going to do, as Dr. Fenoy indicated earlier, is that from the conversation and discussion this afternoon, is that you've given us a task and some thought processes around the reopening and what we need to look for and be very considerate of when we're talking about opening schools, and most importantly around the safety net for our students and adult learners. So what we're hoping for is that when we come back for our next meeting, it's being able to report out to the team in regarding to the progress that we have made based on the feedback that we have received from our dialogue here this afternoon. That's from, my point of view. At this time, I think it's very much appropriate, of course, for Dr. Fenoy to, close us out and give us our lasting remarks. Dr. Fenoy.
Yeah, Representative Wilhite, I just saw your email. I agree. So we won't be waiting a month. It'll probably be give us 1 week to work, and we'll probably try to get you back on the week after. The good news is that you have validated some of our initial thinking. So we have some deliverables that we can share with this group. I think I've heard one of the things that stood out to me was a sort of re-socializing and helping people understand, not in writing, what we're going to do is video, like all of our Clorox machines that we use to mist the buses. I really show people how we're cleaning, increasing those protocols. I think our chief operating officer, to our friends at FAU, I hope you would allow us to call you to kind of hear some more about the specifics that you're using with your campus.
Absolutely.
So if Ms. Paul, if you can exchange numbers with our friends from FAU, I think that'll be a great connection. I think Dr. Schechtman, I'm looking forward to some more intense conversations around how we, what is our role in the whole vaccination process. I think this duality of COVID and flu is real. I think, Representative Wilhite is one of several parents on this call, this idea of when we get back to work, or even some written questions. Okay, we'll take that in consideration. But I think there's still the parent piece to this that we have to keep working through, making people feel comfortable. I will say right now, my feeling is that we will be in some sort of hybrid approach, meaning for families, like we kind of incentivize perfect attendance in our normal world. And so we need to kind of de-incentivize that. And so, I think what we will probably ask a lot more of next week after next is around, those parent pieces, like with the fevers. I mean, if my child is teething, do I let them come? Like, these are the things that I think we need to hear from our pediatricians and other public health officials. What sort of guidance do we give to parents about their role in this? And then, I think next time I would like to hear more about the adults. So you have to remember, we have a lot of employees that I believe will be significantly afraid in some cases. And so, the Dr. Oswald and Mr. Oswald and Dr. Sheffield, in their work with our mental health teams, we realize that this is going to be a heavy lift, just getting people reacclimated back into the workspace. One of the challenges that I have, I heard Dr. Schechtman and others say, my children have never gone this long without a cold or a cough. And we all know as soon as you put a child back into a building, there's going to be some natural virus exchange. I think where I'm challenged is that some parents may go to the extremes. Like, instead of just the normal, a bunch of kids are around each other again, people are going to fear the worst. And so, I think that's a conversation that I definitely want to get deeper in, just helping mitigate those pieces of what would be normal sort of transmission of just kid-like stuff, and how we offset that with the realities of COVID. So again, to respect your time, I thank you guys so much. I would argue that my team has learned a lot. We will debrief quickly. We will get back to you. And if there's any more closing comments from any of the participants who are not staff, I would welcome that as a closing comment.
So, Dr. Fenoy, thank you. I would just say I think there's so many things to think about in talking about this. I mean, I just came to my head, even what if a child is exposed or sick and their parent is a teacher? So now we have to take the parent out of a classroom that now, doesn't allow, and you don't have enough teachers to fill that classroom. And so there's just so many things to think about in this. And that's why I said the question and answers, to just spitball that and put those out there to kind of get those thoughts and people thinking about things. Cause I think there is so many questions and possibilities. So thanks. And I appreciate it. I think this is the good kind of thing we do where you involve the community and get people's input from a vast group. And I think this will be a great help to you and your board in making the right decision for all of our kids.
Thank you. And I'm going to commit to let us come up with some more questions after we debrief this week, and I'll get that back out to you Friday or early next week to be prepared for the following week. That'll keep us accountable to staying true to this process. Ladies and gentlemen, 6 o'clock. Today's my birthday. I'm cooking steaks on my birthday because we're not going anywhere. But I did go out to a restaurant today with my son for breakfast at Cracker Barrel, and we were the only people in the restaurant, and it was great. So again, thank you all, and we'll talk to you soon.
Thank you. I like medium rare, Dr. Fenoy.
Thanks, everyone. I really enjoyed it.
Thank you.
Thank you.
Thank you.
Thank you. All right. Thank you.